We need to continue to acknowledge what's happened in the past. And I've talked about Tuskegee, I've talked about Henrietta Lacks, but there are real issues going on today.
I trust the scientists, and it is the scientists who created and approved this vaccine.
Good morning. I'm Jonathan Capehart, opinion writer for the Washington Post, and welcome to Washington Post Live. Polls have shown public wariness of the coronavirus vaccine, and that distrust is most pronounced in the Black community, a community disproportionately decimated by that pandemic. How do we build trust in the vaccines? And more broadly, how do we address the racial equity issues in healthcare the pandemic has revealed? I have two people joining us now to discuss those very questions. Mayor Steve Benjamin of Columbia, South Carolina, and Dr. Valerie Montgomery Rice, President and Dean of the Morehouse School of Medicine. Thank you both very much for being here today.
Thank you for having me.
Mr. Mayor, I know you are the mayor, but I'm going with the doctor first. A December survey. Dr. Montgomery Rice, a December survey showed 35% of Black Americans would probably or definitely not get the vaccine, even if it's free and deemed safe. Talk about what's behind that anxiety and what it would take to build trust in the vaccine.
So first of all, Jonathan, and to the mayor, thank you all for having this conversation. It is one that I have been having a lot over the last couple of weeks, whether it was in the living room with my husband or over Zoom or on some other network opportunity like this. We clearly understand these intercultural issues that have happened in the Black community. We appreciate our history and the mistrust that has been developed over the years back from slavery, right? When we were brought here to this country and forced to participate not in just building this country, but also our bodies were used for experimentation against our will. And we know about Tuskegee. We know about the Mississippi appendectomy story. We know about the stories of women who were forced to have hysterectomies without their consent in this country. We know about Henrietta Lacks. And all of those really raise concern for us. However, what we also know as healthcare professionals and as scientists, that we have over the last 30, 40 years really been pushing to make sure that we had seats at the table, that we were in the rooms where these discussions were being had about what type of clinical research needed to occur to eliminate health disparities, what type of investments need to be made in our community so that we could adequately participate in clinical trials. With this vaccine and this pandemic, one of the things that happened was the curtain was pulled down. And everybody could see the health disparities, not just the people in our community, but majority communities could see how health inequities had led to the disproportionate burden that Blacks and Latinx persons are experiencing with this virus. Now, the question is, what do we do about it? Well, we had to make sure that we had the health prevention strategies, the 3 W's, washing your hands, watching your distance, and wearing your mask. Then we had to recognize that we were not disproportionately impacted by this virus because we were Black. It was because we were essential workers, because we could not socially distance, because of all of the struggles. So the first part of the answer to your question, Jonathan, is we had to acknowledge the history. And then we had to not be dismissive of people's concerns, but address them head on. And now we can do this through these type of conversations, but also with really moving people from vaccine hesitancy to vaccine acceptance.
And one of the ways you have personally done it, and I was watching it when it happened live on CNN. You got the vaccine with Dr. Sanjay Gupta live on morning television. Why was that so important for you to get the vaccine in such a public manner?
So I'm a scientist. I've done lots of basic science research, lots of clinical research, etc. I had looked at all the data, and what I wanted the community to see, the world to see, that I clearly would not put something in my body that I did not believe was safe. I think most people believe that it's effective, but the question is it safe? And I wanted people to know that I was choosing to do this. I was choosing to make a decision that allowed me to empower myself to be healthy. And so I thought it was very important. And by the way, I got my second vaccine this morning. So my arm is a little sore, but pretty good. I mean, not really feeling any side effects yet.
I was literally about to ask you, have you gotten the second shot? You got it this morning.
Sanjay and I got it this morning. We didn't do it live because there's a lot of other stuff going on in the news, but there will be some information about it that I'm sure that's out in the public. But we both got it again. This is our 3-week period.
Mayor Benjamin, will bring you here into the conversation. What are you hearing from your constituents about the vaccine? Are you hearing any vaccine hesitancy among the people in Columbia, South Carolina?
Less and less, and I think it's because of the work of folks like the fantastic dean here, being very public and open. When you get to a point that where we are in American society right now, and it's always important to realize the incredible challenges we're facing. That not only are we dealing with the greatest pandemic since 1918, the greatest economic disruption, these frontline workers who don't have the ability to socially distance like we do, probably the greatest economic disruption since 1932, and still, yes, the greatest social unrest since 1968. We're in a time right now where there's a lot of incredible distrust out there, and the importance of being transparent and open. The way that we're seeing our medical professionals, and I'm seeing a great deal of leadership from all of our medical professionals, but certainly our African American medical professionals and those of color being out front and open and helping lead this charge to try and deal with this incredible challenge. We of course know that confidence in vaccine safety and effectiveness are the top predictors of whether or not people will actually take it. So we've got to constantly do it, share the message that the dean has just shared. And then also, I think, taking advantage of the challenges that we were facing, these historic challenges I just mentioned earlier. We've also got to continue to reach out, other trusted voices, elected officials, these new, incredibly strong voices that have emerged over the course of the last year, fighting for social justice, using them as trusted messengers, going to the traditional sources. We've always gone to an African American community, our faith leaders and our barbershops and the like, and the beauticians, really stretching very hard to build a formal structure, some strong intergovernmental, intersectoral ties, public health officials working with public leaders, but also working with some of those informal sources that carry a great deal of credibility in the community, and continue to work to pull it together in these incredibly challenging times that the dean mentioned earlier. We're living in historic times, and not always historic in a good way.
Right. Well, Mayor Benjamin, have you gotten the vaccine yet?
No, man. I have all this gray hair, but I don't fall into any of the categories just yet. I am waiting. I'm waiting with bated breath, and I am ready. I take every year. I take my flu vaccine in front of the cameras. I roll up my sleeve and sit in the parking lot of City Hall and take it. And when the opportunity comes for me to receive my vaccine, I will take it publicly as well. I think it's important. I will say this: as more and more concerns arise, and I think we're hearing in every state, people want greater access. There are people waiting in line in different states. We see these amazing images. It's going to be important for all of us to make sure that we continue to push the message of equity in this discussion. Let's get the vaccines out rapidly as we possibly can. Let's cover every corner of America. But we're going to have to make sure that people who are relatively healthy, like I am, who are people of means, that we wait our turn and make sure that those who may have comorbidities, those who obviously fit squarely into the boxes, the early boxes, that are indicators of a thoughtful process. It's important that we do that.
Well, I mean, I asked the question of you about the vaccine because we have seen elected officials
Yeah.
who, particularly here in Washington and in Congress, who have been able to get the vaccine for reasons of continuity of government. So I just wanted to know about that. But let's talk a little bit more nitty gritty about the vaccine, Mayor Benjamin. And I wonder, I mean, the Trump administration has delegated responsibility for administering the vaccines to the states. So I'm wondering, does your city, does Columbia, South Carolina, have adequate delivery systems and personnel in place to get the vaccine out to people who want to and need to get vaccinated?
Well, first of all, this is the greatest pandemic that's hit the world in over 100 years. I've been clear and unabashed in my opinion and at times responsible criticism of the fact that I thought that a centralized approach from the federal government was probably the very best way of dealing with everything along the way, from testing to PPE and certainly to the vaccine. I don't believe that a fractured approach across the 50 states and the territories on top of that is the way to do it. We have had a great and wonderful relationship with our State Department of Health and Environmental Control, our hospitals, and others who are helping deliver the vaccine. And I mean, just this morning, a conversation with the CEO of our largest health system in the state, and also with the individual at our State Department of Health and Environmental Control, separate conversations, the person charged with communicating with communities of color. And those are regular conversations. I do wish, certainly, I'm a believer in cities. Not only am I a former president of the African American Mayors Association and the U.S. Conference of Mayors, I'm also president of the Mayors Mutual Admiration Society. I believe that mayors get things done. I would love to have more functional and clear control of delivery of the vaccine. I believe we could get more done. But absent that, making sure we continue to foster this constant dialogue, this constant transparency, these constant partnerships that we've been able to do with some success around testing and PP and the like. Obviously, it gets a whole lot more technical when you get to the vaccine distribution. But we can get it, hopefully, if we are able to show some dexterity and wonderful partnerships that reek of equity in delivering in the first stages of the vaccine, that over the next several weeks and months, we'll see a much more robust supply that allows us to meet the needs of all of our citizens.
Should also point out that you were the president of the United States Conference of Mayors also. Dr. Montgomery Rice, what do you think is causing the lag in the vaccination rollout?
Well, I think, first of all, if you look at what was at the beginning was they thought that, okay, because it's 2 doses, the 2 that have been approved, Moderna and Pfizer, that the federal government, as I understood it, they were withholding some part of it so that people could be eligible for, we would have doses for people to have their second dose, right? So they would send it out to the state based on the prioritization that we had put forth on who should get vaccinated first, second, third, fourth, and we're giving them the dosage that they needed for that population in a staged manner, and then holding back 50%. Well, there was a study that just came out of the Annals of Internal Medicine that said that by reducing the amount of vaccine doses withheld to only 10% instead of 50%, we would be able to supply a steady dose of 6 million doses per week, which in the US could avoid 29% more cases over 8 weeks. This is a moving target, and so we have to be agile. We have to be flexible, remembering that they are recommendations. that have been put forth by the FDA and the CDC and the National Academy of Medicine about how we should stage who gets vaccinated. Does us no good to have a bunch of vaccines. They only become relevant when they are in people's arm and they become vaccinations. And we have heard of cases where people have been discarding vaccine because they got to the number of people that they could vaccinate based on the categories, and there was still amount of vaccines left in vials that could equate to a dose. Well, we don't want that to happen. So what we need to do is be agile and common sense. Agility along with common sense. So eventually we want everybody to be vaccinated. So if I'm in a room and I'm giving out vaccinations and there are people, let's say like our mayor here, who doesn't quite meet the age range, but he is an essential worker. And if I had vaccine available, I would ask him to step up right then and take that vaccine. And
Keep
so
on talking.
if you know,
Advocate.
it came out earlier today. The Biden-Harris administration has acknowledged that they're going to ask for release of all available vaccine doses and break away from the current administration policy. And so I think that we are going to have more access. Now, this is really important, Jonathan, because we're doing a vaccination Saturday here at Morehouse School of Medicine. And because on Tuesday, we vaccinated civil rights leaders, 30 of them, Ambassador Young, Dr. Lewis Sullivan, Henry Hank Thomas, Freedom Rider, Henry Hank Aaron, and 26 others. And we then announced that we were going to do these vaccination Saturdays for the next 4 weeks. We have gotten 2,000 calls. And we were talking about people 75 and older. So please don't tell me that Black people don't want to get vaccinated. That's not true. They are ready. But here's the challenge: manpower. It is a process. You have to get the vaccines in a thawed position. You then have to unthaw them. You have to let them sit at room temperature. You have to have appropriate people who can draw them up and then actually administer the dose. You then have to monitor people for at least 15 minutes. And at that time, we're using our medical students to hopefully get them to fill out the V-Safe app so that they can report their symptoms afterwards. So it is about a 40-minute process if you do it right with registration, vaccine, because actually get the injection takes 5 minutes. It is the watching afterwards and a little bit of work before so that we can make sure that we can document everybody who's been vaccinated, give them the right information such that they come back in 3 weeks. So manpower, we need more resources at the state level, at the city level, and in our departments of public health so that we can hire additional personnel to help with the administration of the vaccine.
Well, Dr. Montgomery Rice, you stole some of my thunder. I was just about to announce that breaking news. That is quite all right. That means you are on it. You are totally on it and on the news. So let's broaden this conversation out from the vaccine to the inequities in healthcare. I'm sure the two of you have seen the video of Dr. Susan Moore, the Indiana physician who recently died from COVID-19, who took to Facebook in her final days, is what we now know as her final days, complaining righteously about her treatment. We have a clip of one of her videos. Let's watch.
So I started asking, send me to another hospital where they can treat me. And if they're not going to treat me here properly, send me to another hospital. Well, next thing I know, I'm getting a stat CT of my neck with and without contrast. The CT went down a little bit into my lungs, and you could see new pulmonary infiltrates, new lymphadenopathy all throughout my neck. And all of a sudden, yes, we'll treat your pain. You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain, if I was white, I wouldn't have to go through that.
Heartbreaking.
Go ahead, Dr. Montgomery Rice. I was just about to come to
All
you.
I can tell you as a healthcare professional, so this is on my social networks, we were appalled. Even though we know it happens, we know that our degrees don't protect us when we go into sometimes the environments. And that is appalling, particularly when we have seen the greatest example of health inequities in this country, right? Because our sitting president and everybody that has been infected in the Rose Garden or who is attached to the current president has been able to have, first of all, access to regular testing such that when they turned positive, they could get not only just access to remdesivir and steroids immediately, but many of them probably got monoclonal antibodies, which has been shown to be most effective when you get them within the first 72 hours of your diagnosis. That hasn't been made available to the public, and clearly has not been made available to all those 300,000 people who are now dead. And so a example of health inequity, and she laid it out for us. Again, snatched that curtain down so we could really see what happens in people's day-to-day lives.
And before I have you respond, Mayor Benjamin, I should also note that the hospital where Dr. Moore was first being treated has launched an investigation, and in a statement it says, we have initiated an independent third-party review of Dr. Moore's case, as well as our overall patient care protocols, communication, and procedures. Mayor Benjamin, your reaction to, well, one, the clip that we just showed, but also the overall story of, to Dr. Montgomery Rice's point, the degrees that we might have and the stature we might have doesn't mean a thing sometimes in the healthcare setting. Your reaction to a doctor having to beg for treatment?
Jonathan, I grew up in some of the toughest neighborhoods in America. I grew up in South Jamaica, Queens. I literally watched young men die as a teenager. Before my role as mayor, I served as a cabinet secretary. I ran the second largest law enforcement agency in the state. I've seen things over the course of my life that have always humbled me. I found painful. Every time I watch that video, I tear up. It is incredibly to watch. It's difficult to watch. It is illustrative of the fact, the defining fact that very much since the birth of this nation, that race has defined so much in this country. And the story of the African seed and the American son is one, yes, of triumph, but also of great pain. Dr. Montgomery Rice particularly laid out some of the incredible challenges. This is a home, South Carolina is a home of Dr. J. Marion Sims, and he's deified in the statue. Capitol. And I speak often about the stories of Lucy and Anarch and Betsy, the women that he craft on as the father of modern gynecology. The stories are real, and they're painful. And that painful video is illustrative of the proximity that all African Americans have had to this particular virus. Let's get past the historic inequities, but this particular virus. Is a number last month that suggests that 31% of all African Americans across this country know someone who's died from the virus, and that proximity. And usually we hear people like Brian Stevenson talking about proximity in terms of justice and criminal justice and systemic injustice and law enforcement. This enemy that the virus has become to all communities, but certainly communities of color, is just so real. And that's why it's so important to have it. You meant, and I'm going to say this, I'm not going to spent a lot of time there. You talk about continuity of government and access to the vaccine, and some of our champions. My Congressman Jim Clyburn is a champion of addressing every single inequity that we discussed here today. And to watch him get vaccinated was powerful, was meaningful to me. I love the man. To watch others, quite frankly, who have spent months after months after months minimizing the impact of this virus on the country, also get access to that very same vaccine. My phone blew up. People speaking to hypocrisy and the like, but nonetheless, I want to see every single American be vaccinated. The reality is that we've got to continue to use our bully pulpits to speak, just as we were dealing with testing. Testing gives you data. Data gives you intelligence. Intelligence gives you the opportunity to make good policy that allows you to make sure that we're all covered. The challenge is now we've got to use the power of that humanized data, that powerful video, that testimony, to make sure that as many of our citizens who may not have access to the resources that we have understand the importance of getting vaccinated. And that's why I really appreciate your initial questions and Dr. Montgomery Rice's initial answer, because we cannot just admire the problem. We got to get action, and we got to continue pushing for more and more action.
You know, we seem to, as a nation, keep breaking records when it comes to the number of people succumbing to COVID-19. And yesterday was yet another one of those days. According to the COVID Tracking Project, the United States reported more than 4,000 new coronavirus-related deaths yesterday. So, Dr. Montgomery Rice, given that data and how it seems like every day has been a record over the previous day, therefore an overall record, how concerned are you about this more contagious variant of the virus first identified in the United Kingdom that's now been reported in the United States?
Well, first of all, Jonathan, I always believe in science. And so what we have found out thus far, and we still have much more research to do, it does appear that our vaccines will protect against that variant as it's protected against what we thought was the first or the second or the third variant. And viruses always mutate. We know that with the flu vaccine. And so we are always going to be monitoring this. So what I say to our community is, don't let that information impact your decision on whether or not to get vaccinated. You talked about 4,000 cases. We keep hitting new highs every day. What we know, if we get more vaccines in people's arms and they get vaccinated, what the vaccinations do, you all, it doesn't prevent you from getting the virus, but you have antibodies in your system that can chew up the virus and decrease your viral load to a point where you don't become a hospitalization and you don't become a death. So what we will start to see first are the death rates go down, hospitalization, and then cases later. Because remember, we don't necessarily know yet that just because I've gotten the vaccine that I cannot infect someone. He knows that I should see a decrease in my chance of getting the disease, being symptomatic, going to the hospital with symptoms, and hopefully dying. But we must continue the 3 W's, washing our hand, watching our distance, and wearing our mask, because that's the preventive health strategies that also will help mitigate the number of cases, because I won't be able to pass on the virus. So very important, vaccination, vaccinations, and the 3 W's.
And as Dr. Corey Hebert of New Orleans said on my Sunday show on MSNBC, wash up, mask up, separate, and vaccinate. Mayor Benjamin, we are completely out of time, but I cannot let you go without getting your reaction to the events on Capitol Hill on Wednesday. Are you concerned about the ability of the federal government? Well, let me scratch that, because you're the mayor of a southern city. You're mayor of a southern city in South Carolina. And you're a Black mayor. Just give me your reaction briefly to what you saw on Wednesday here in Washington.
I was offended in so many different levels. And back to your initial question, I do not question the federal government's ability to control what happened then just to have on any other event in history. There must be a willingness, however, to do so. You remember just 5-6 years ago, as we dealt with the removal of the Confederate flag here in South Carolina, we will always face these challenges. The question is whether or not we're willing to work together as a country to speak to our better angels. We have a wonderful relationship with law enforcement here. If in fact, and I do feel comfortable that with the new administration in place, we'll get the leadership we need to pull people together and to push back against the excesses of America. We can do it.
I wish we had more time, but we are over time. Mayor Steve Benjamin of Columbia, South Carolina, Dr. Valerie Montgomery Rice, President and Dean of the Morehouse School of Medicine. Thank you very, very much for coming on Washington Post Live.
Thank you so much.
Thank you for having me.
And as always, thank you for joining us. I'm Jonathan Capehart, opinion writer at the Washington Post. Thanks for watching Washington Post Live, and try to have a good weekend.